with a background in public health, the advice I was getting from my pediatrician to start the childhood vaccination series, I didn't question it. I trusted that guidance, and we were following that. Our neighbors were hesitant, and we were going through the new parent journey together and having conversations about these experiences as new parents. And this is 2013. That becomes relevant in a moment. And they were, as we hear people say, doing their own research. It's the information age, the age of information. They were reading parenting blogs and watching YouTube videos.
Where things really hit home to me, and certainly with the late 80s and early 90s, they dealt with a lot of different groups and having different things in terms of focal infection and other things and natural dentistry and that kind of stuff. One of the things, we were in New York City, and he was talking about all the different toothpaste. And I said, what do you mean all the different toothpaste? I'm thinking Colgate, I'm thinking Crest, right? So I went over the Saks right on Fifth Avenue, and they had a section of consumable products. They had more than 20 different toothpastes. Almost everyone had no fluoride, and more than half were charcoal-based.
We live in the communication age, and it used to be that before the internet and social media, we had silos of information where it was curated and edited. But as we went through the democratization of information, all of a sudden everybody had access to information. So the signal to noise ratio entirely changed.
I say this all the time. I think a lot of times it's the blind leading the blind with a lot of subjects across not just healthcare, but other industries too. And so, sometimes I think half knowledge is more dangerous than no knowledge. And
there are a lot of things that can drive human behavior. Unfortunately, I think it can come down to the attention, the money that might come along with it. I think not everyone is always as well-intentioned as we hope that they would be.
We live in the age of communication, but not in the age of good information. Ready, Annie, everybody?
Ready.
Awesome. All right. Terrific. Welcome to the Pulp Podcast, where we talk about all things dentistry and non-dentistry from a generational perspective. I'm joined today again with my co-host, Dr. Ann Koch from Palm Beach Gardens, Florida, and Dr. Pasha Shahidi, right here in studio, along with our co-host now, Dr. Rowan Nash, also here. And we have a very great guest here. We're going to talk about a very important topic that's quite special and close to my heart, Pasha. The topic of misinformation and bad information that we should be careful about. So why don't you introduce our guest?
Well, it's exciting because I get to hear about this when we're off camera all the time from Dr. Nasa. And today we have an expert in this subject. Dr. Brittany Seymour is joining us, so we're lucky to have you. She's the Associate Dean at our school at Harvard for Faculty Affairs. She's an Associate Professor, Director of Global Health Discipline at the Harvard School of Dental Medicine. She holds a full-time appointment in the Department of Oral Health Policy and Epidemiology and the Office of Global and Community Health. Dr. Seymour earned her DDS from the University of Colorado and her Master's of Public Health from Harvard School of Public Health. And of course, she does a lot of amazing stuff across campus, but she also specifically consults for the Health Communication Division at MIT Center on Civic Media and the Media Cloud Project. We are lucky to have you here today to talk about dental misinformation.
Truly. Thanks for having me. It's a worthwhile topic.
Totally.
It definitely is. Because, all of us who've been online, see this more of a deluge of misinformation or information that seems to us to be very unfamiliar compared to what we have learned in school and seems to be counterintuitive. Some people call these conspiracy theories. Some people call it just bad information. So what we want to do today, Dr. Seymour, is to get down to the basics of what causes these types of problems. And, for patients that are listening, for people out there that are listening, as well as for dentists that are going to face these, what are some of the best ways that we can deal with these questions that come up on daily practice?
That sounds good. I might start with a question for all of you. Just from your experiences, what do you think causes it? And what has been your experience with this?
I have an answer, and I say this all the time. I think a lot of times it's the blind leading the blind with a lot of subjects across not just healthcare, but other industries too. And so, sometimes I think half knowledge is more dangerous than no knowledge. And I know you talked about this the other day or last week. But I don't know. I feel like sometimes when something propagates across social media specifically, it's almost like, burning a match in the middle of the woods. It just takes off and there's no stopping it. So what causes it to me is, people wanting to get views, people wanting to get attention. And from there, I think it's a little bit too late.
I think it's a very slippery slope. I think there are a lot of things that can drive human behavior. Unfortunately, I think it can come down to the attention, the money that might come along with it. I think not everyone is always as well-intentioned as we hope that they would be. I think it's hard to put yourself in that and to be like, oh, some people do things and it could hurt others, and sometimes they are aware of it, sometimes they aren't. I think some people also do it unknowingly. They accidentally hear a story from their neighbor, it comes to them out of maybe not knowing better. They believe it. We believe things that people tell us, maybe because we're good-hearted or just confused or not sure. So yeah, I think also with generative AI and all the things that are coming up recently, it's also hard to know what's real anymore. You open your phone, you're scrolling on TikTok, and you get a video of a dolphin flying over the ocean, and you're thinking, wow, what a beautiful sight. And then it's fake.
Get me.
Yeah, it gets me too.
Yeah, I think it's social groups and friend networks. And I think it's been that way for many years. And it's kind of like, even like if you need an electrician, do you go through and look for a real analysis? No, you ask a friend. And I think, I don't want to use the term cults, but I think the social grouping things I've seen in the past in terms of having, let's say, a different opinion. And I really am concerned, and I'm so thrilled to have you here, Dr. Seymour, because I share wholeheartedly exactly the concern that Roween just mentioned. And that is about generative AI. It's not for people like the three people sitting next to you. It's like for people like me. I'm 76, and for people over 60 years old, certainly over 70, it's very, very confusing. And it's very tough to differentiate what's real and what's Memorex. Memorex used to be a thing in the past. I had an ad, what's real and what's Memorex. So when I see some of this stuff that's on the internet, that's AI generated, I'm able to figure it out. But I have a lot of friends who think, oh my God, that's the real thing. That's an enormous concern for me going forward, as is the geriatric population in terms of being more susceptible to misinformation.
For me to add my 2 cents, to make it brief, we live in the communication age, and it used to be that before the internet and social media, we had silos of information where it was curated and edited. But as we went through the democratization of information, all of a sudden, everybody had access to information. So the signal to noise ratio entirely changed. As people raised the noise, now we have a cacophony of information, and we just are unable to tell the difference. So the problem has become one of who gets first to whoever has, it's kind of like the old news cycle thing is becoming shorter and shorter. Whoever gets the information first, now you have to unseat that information. So I feel like we live in the age of communication, but not in the age of good information. It's just whatever's out there. So I'll be curious to hear what you think is the thing.
I'm happy to share what I think, what I've learned. You introduced me as an expert in this area, and it feels that the more I learn, the less I know.
That's the true expert.
So maybe if you're up for a little bit of story time, I'll start with maybe just personally how and why I got into this topic. It wasn't something I set out to become an expert in. It sort of happened, as many life courses do. And then talk a little bit about a brief history and a little bit about the anatomy of the internet and what we've really learned from that. Sure. And then we can talk about, okay, well then how do we go forward? Where do we go from here? Yeah. So back in 2013, which really doesn't feel that long ago, but technology-wise, internet-wise, social media was a different world back then, 10, 15 years ago. It really was. I became a mom. I had my first and only baby. Oh. And at the same time, my next door neighbor also had her first baby. With a background in public health, the advice I was getting from my pediatrician to start the childhood vaccination series, I didn't question it. I trusted that guidance, and we were following that. Our neighbors were hesitant. And we were going through the new parent journey together and having conversations about these experiences as new parents, and they were hesitant. This is 2013. That becomes relevant in a moment, which this worried me. We share space. Vaccinations are important. Yeah. And they were, as we hear people say, doing their own research. It's the information age, the age of information. They were reading parenting blogs and watching YouTube videos. And a lot of these sources were not what I would have considered a health expertise source or a scientific source. But for them, these were trusted sources. Honestly, at the time going through it, I was judgy. I was judgmental. And we had some difficult, contentious discussion about this because it almost felt personal as a health expert, a public health expert. So this is 2013. By the end of that year, 18 states in the U.S. had fallen below protective herd immunity for measles. And early 2014, the United States had the largest measles outbreak in a generation. All of this was right in parallel with what I was experiencing firsthand with my neighbors around vaccine hesitancy. And as time went on through that outbreak, research was showing that not achieving optimal herd immunity was due to unvaccinated individuals by choice because of concerning information they had found online. Wow. So it was a professional interest, but it was personal. This was my baby.
That's what drove you deeper into this field, right? That story.
That sparked my interest. How does this happen? My neighbors were professional, intelligent, rational, wonderful people. And in my opinion, were making poor health decisions. So I wanted to know, how does this happen? They weren't ignorant or uninformed per se, right? And so that sparked an interest. I took on a very small pet project. I had a fellowship at the time. They asked if I wanted to do an independent project. I said, I think this social media thing might be a problem when it comes to health information or health misinformation, and I'd like to learn more about it. And so what was going to be just a couple months of a pet project looking at just a couple topics, vaccinations and community water fluoridation, because I'm also a dentist, turned into a multi-year research initiative.
Wow.
Terrific. So at the seed of it, what did you find? What is the seed of misinformation? Is it just the fact that people have more access to communication means and therefore poor information travels faster than good information?
There are two answers to this question of how did this happen. And at the time, I thought social media was the problem. That is correct and incorrect. It's correct because of the rapidity and the vast amount of information that can spread, right? So by 2015, 100 hours of content were being uploaded to YouTube per minute. Every half second, a new blog was being created. 700,000 pages of Facebook content were being created every day.
Wow.
That is a massive amount of content. And one Facebook post could get around the world faster than anything else at that time.
Yeah.
So, yes, social media was part of the problem. But also, this is as old as humans are. It's gossip. It's how we've always been.
Yeah.
You know, it was the water well and then the water cooler and then the social media platforms. So we are just inherently gossipers, and not in a malicious way or not in I need the tea about my neighbor. But this is how we're wired. We lean into gossip as a form of cultural learning. When there's uncertainty, any type of question, how do I behave? what do I do in this situation? We lean into gossip. We learn from stories we hear from neighbors, or that work meeting that didn't go well for my colleague, so I'm sure not going to do what she did in that meeting next time. These aren't written rules, but gossip it's part of human nature.
Dr. Seymour, I know you talk about dental misinformation behaving like gossip. But I'm curious because I wonder, when you think about gossip, and misinformation usually comes back to topics that are so inflammatory or so exciting. I wonder what the average person thinks about dental misinformation and gossip, because maybe it's not so exciting to a lot of people. But did you feel when this, issue with the neighbors and the measles outbreak was happening, the source of the problem was that people simply wanted to talk about something and they found the most inflammatory and out-of-pocket thing they could talk about was vaccines? What did you think was the source of it?
I think that there's a wide range of reasons and intentions for misinformation online. And there's also a difference between misinformation, which is when something that's, incorrect is shared knowingly or unknowingly. And then disinformation, which is when it is knowingly shared with intent to cause some sort of impact, right? When someone knows this isn't fully true, or it's been altered in some way, and they share it for an impact. So, I think generally, I tend to, you said something at the beginning around we're all generally good people and empathetic and give people the benefit of the doubt. I think we're often dealing with misinformation, particularly with our patients who are really just,
But to see the point that Parsa is saying as how things kind of propagate, could this be also because of the fact that the structure of social media being organized around the concept of viewership and likes and things like that? Does it not necessarily mean that things that basically grab attention, just like the news headline, right? If it bleeds, it leads, because it grabs attention, right? So we live in an attention economy. So these are, so controversial points that are beyond. It's one of the things I tell my son when we're watching movies. I'm like, see this kind of behavior. The reason it's on TV is because it's not supposed to be that way.
Yes, it's like
No one's going to show good behavior in a drama because it's going to be boring. No one's going to watch it. Right.
Totally.
Right? So it's been historically the case that things that are supposed to be like either incorrect, wrong, or bad behavior get promoted first.
Yeah.
And the problem is, as you can see, is like it's certain if you are relatively friendly, as you said, good people, you want to believe the things that you hear and you're prone to gossip, then you will tend to kind of go off track, and all of a sudden, could that be possible as an explanation?
So as the internet was emerging in the 80s, 90s, and really starting to become the World Wide Web, have you heard of the term, the information superhighway?
Yeah.
We entered into the age of information, where you're right, those historic, traditional gatekeepers of information didn't matter in the same way, right? Where there was one nightly news story versus
trusted sources.
Now we were in the age of information, or information disorder, almost, depending on how you want to look at it.
Yeah.
I have a question, and again, it's a different generation thing. That's what's kind of fun about the all group, is the thing that I personally don't understand. I do understand their effect, is the whole thing about influences. And how do you think that influences gain the traction that they have achieved? And even furthermore, how have influences become more reliable than science?
That's a great segue. So when we're thinking about the age of information, through our research and our case studies, our team built a tool where we could visually map out the internet. So this idea of cyberspace, they were able to create a visual representation of cyberspace. And what we found was that it's not a network of information. It's a network of social connections and relationships, linkages. So you have a source of content, and then you have people linking in and leaking out. And it became this true web of just social networks in cyberspace and often around given topics. And so what that really reinforces is that this is not an information era. It's the era of social influence. And we know that our social networks are the number one influence over health behaviors, on or offline. And so that anatomy of the internet has had a major influence in how people seek out, consume, and choose to rely on what they're finding online, because it's literally curated for them from their peer and social networks online.
Yeah, honestly, from a different generational perspective, I feel like we also live in an age of efficiency. And I'm curious to hear your thoughts on this, but I feel like, if I wanted to get information on a topic, life is go, go, go. My phone's in my hand. Google is up. Typically, if I search something on YouTube, I'm going to just trust the first AI Google search that comes up. Or I'm going to scroll on TikTok, look something up, see someone's experience at a restaurant and say, oh, yep, that looks great. Pictures look great. I'm going to go do it. I also feel like the way that research is put out and published is often not very digestible to many people. And I'm wondering if this topic of access does kind of translate into a lot of these things are boiled down, sometimes too much, to the point where we lose sight of the true science behind of things, or in this process of boiling down, it gets completely changed in an incorrect way. But as we try and make things more digestible, does that also make us more prone to misinformation? And also, is this kind of the thing that social media propagates? Because people are pumping out videos like this, but to publish a systematic review, you need to take blank amount of time reading articles, blank amount of time screening. And by the time you're able to publish your systematic review, how many videos have come out in the process, for you to also share your scientific claims? So I'm curious to see those two things in kind of juxtaposed in our society.
We were actually able to map out and visualize and see that dynamic at play online.
Wow.
So when we did a case study around the topic of community water fluoridation online, there was a cluster or town, as we called it, of who we would have considered the health or the scientific experts around community water fluoridation, all in their own little isolated bubble of science. There was a cluster of conspiracy theorists who thought the government was deliberately poisoning people or anything. That was a fascinating corner of cyberspace for me to dive into. And back to this idea, the age of influence. Us and others studying this phenomenon also noticed in these clusters that were really based on our social identities and who we were connecting with around shared norms and values, the type of information that we felt was valid. Each cluster had these norms that were determining the sentiment of the conversation. And there was often, almost always, I'd say, a central kind of node. We called them mayors, but today they would be called influencers.
Oh, wow.
Where the majority of the other folks in that cluster were linking in and following their lead.
Yeah. One thing I want to ask you about, and I think this is true with probably a lot of things on Earth, but you often have to follow the money. And right, so we talk about what's going to get specific information out into the world at a faster rate than, really mundane, basic fact that probably people don't care about is attention. And, I think one of our jobs as, domain experts in the field of dentistry is to be able to find a way to bridge a gap between the people who are kind of working for views and clicks, and then the true experts and the expertise that we want to put out there. And so I think it's on us to find a way to actually incentivize those key influencers and people, like the way the Hubermans of the world do, like Dr. Nasa does, like Peter Attia does in each of their fields, to get to the root, information we want to give across. So I think that's on us to try to find a way. But let's just move past the economics for a second. I think just to play devil's advocate, one thing you talk about is how sometimes an anecdote will maybe carry more weight than a systematic review or a CDC report or something like that, right? And I think the way that the human brain is wired, oftentimes all it takes is just maybe one example of something that is close to home, a friend, a family member, a neighbor,
Yeah.
and boom, all of a sudden you're you're completely bought into that topic and that ideology, and nothing is moving you away from it. So I'm curious, how does everyone here perceive that notion? What is someone supposed to do when they know somebody or have heard about something that affects their way that they think, contrary to the facts that exist? What do you think?
For me, it goes back. The word trust has come up quite a bit here already, right? So I feel like we've had a transition from an age in which we had trusted sources and there were institutions, and we somehow collectively believed that the institutions were going to be true to us. As there was a breakdown through this information age and communication age, I don't know if you've read Martin Gorey's book, The Revolt of the Public. Mm-hmm. That's a very, very good book apropos in this area. There was a breakdown in the trust of the institutions, mm-hmm. and therefore the gravitation towards social media people were the same as Seymour was saying, is the form of a gossip type of situation. It's kind of a community, of a group, a much more relatable group of people that you could trust than some pie in the sky expert out at an institution. So this was really the challenge of what took place. People took the proximal trust far more, they took it far more seriously than that. So, when Fauci came on and said, "I am the science," a lot of people were triggered. They were like, "Well, I'm relating far more with my grandma who had like a thing, and this happened and that happened." Right. So these are the challenges that you have to deal with. So I think, as you said, it's like, the answer has to be personal. So you said to use an anecdote, it has to be relatable to the patients. They have to emotionally get engaged in the situation. And that's part of the reason the most convincing and persuasive forms of argument have always been one that's been an appeal to emotions, even though it's not a logical thing, and it's in fact a logical fallacy, but it works.
Yeah.
It's kind of like politics, Annie, right? Negative campaigning works, right? That's why it's there, but it's not a good thing.
Yeah.
But that's the same thing. So I feel like, we got to work on the emotional component part of it, relate to the patients. I don't think, as you would probably agree, bringing a multi-center study that shows, how something has been, randomized, controlled trial is not going to work. But to me, I always say, like in my particular case, I said, well, I've had this procedure myself, like this many years ago, and I wouldn't be telling you to do something that I've done it myself and everybody else I know. It's more relatable.
I think that makes a lot of sense. I can also, sorry, Annie, I'll keep this super short. I really feel like there is a power in seeing people in front of you and not just words on a page, especially words with very strong diction that are very difficult to digest. Right. When you hear someone's tone, you look at someone telling you something with emotion in their voice and real world experience, it is just more believable, easier to take in, and more, you can just empathize. And I'm wondering if this is mildly a call to action for other healthcare professionals, in that we might also need to start adapting to this new age of influence that you call it, and also become influencers in a way too, and become versed in this social media language in order for us to communicate our scientific knowledge in a way that's different.
The only way you can beat misinformation is with more good information.
Right.
That's essentially what it is.
Right.
That's what we need. Annie, what were you going to say?
Yeah, I was going to say where things really hit home to me, and certainly with the late 80s and early 90s, they dealt with a lot of different groups and having different things in terms of focal infection and other things in natural dentistry and that kind of stuff. But late 2018, 2019, I was helping a friend with a startup. And one of the things, we were in New York City, and he was talking about all the different toothpaste. And I said, what do you mean all the different toothpaste? I'm thinking Colgate, I'm thinking Crest, right? So I went over the Saks right on Fifth Avenue, and they had a section of consumable products. They had more than 20 different toothpastes, many celebrity-backed. I'm not going to mention the celebrities. Almost everyone had no fluoride, and more than half were charcoal-based. And what was interesting to me when I saw them, I kind of fell immediately into the dentist mode. Like, well, these you can put everything, not going to sell them. So I said, ask the manager. I asked the manager, they couldn't keep them in stock. And in fact, it kind of put us down the wrong pathway in terms of developing one product. But the interesting thing to me was I was stunned at how many different toothpastes there were there. And when I looked at it, it wasn't so much what struck me was a scientific creation, or this was the culmination of the years of research. It was kind of all influence generated.
Yeah. Mm-hmm. Yep. And this is when I just ended up diving into this area of research, I thought I was going to be looking at how Facebook is causing people to make poor health decisions. I learned relatively quickly that this is behavioral economics, this is network science, this is psychology, this is how humans are wired. We are social creatures. Our social networks influence us on a routine basis, and we make decisions based on information that we receive, not whether it's fact-based or grounded in the evidence, but if it's personal, if we have an emotional response to it, if it is socially reinforced across our networks by those we trust and care about, and if it's relevant to us.
Right.
No science required.
Do you think the susceptibility of influences and the media thing is a result of the access problem there is in this country to dental care?
I was wondering the same thing. Even just you mentioning the pediatrician, family medicine, it can be really difficult to get a dental appointment. It can be very difficult to get
not just
primary care
getting a
physician
dental appointment, it's the cost. Okay. For instance, one of the things to me is that, there are two real serious afflictions, the common cold and dental caries, one of which can be controlled, and that is dental caries. Yeah. But the two things that we all know, one is fluoridation. What's the other thing? Probably dental sealants. Have you ever gone around and spoken to different dentists what they're charging per sealant? It's $20, $80. I had a period in my life, Dr. Seymour, where I went around to a lot of medical schools talking about cultural competency and other things, other issues. And where I really got focused on this was the number of times I came across generally women who were head of like human resources and social aspects of the medical school. And a couple of times when they found out that I was a dentist, they mentioned to me that they had sealants placed on their daughter, but on their son, it was too expensive. Now, these were people who were assistant professors, associate professors in medical schools. And they shared this to me, and they weren't complaining to me or picking on me. They were very nice. They were incredibly charming. But the fact that here are people in the medical school, and then when they told me some of the prices of the dental sealants, I realized this is outrageous. So it becomes an enormous socioeconomic factor here. And that, when you overlay it, and like, for instance, I don't know, and part of this thing when I was doing it with my friend, we were looking at the edentulous rates in the United States. It's gotten better in the last 8 years, but anybody know what the edentulous rate is, totally edentulous in this country for people over 65?
25%?
Well, it was that. It was actually now down to 17 to 18%. Okay. That's in this country. That's fully edentulous. If you want to get into partial edentulous, partial dentures, full dentures, that number's like more than 56%. So when we have that kind of result, you realize somehow there's a disconnection. And that's why, Roeen, you're thinking the same way that I'm thinking, that there seems to be a connection here.
Totally. Yeah.
So to kind of sum it up, it seems like, so it is more proximal, it is more about trust, it is more about connecting as a trustworthy source. So what would be the message for patients? What would be the message for the dentists out there who face a patient who would be making a claim that to them sounds like misinformation?
I'll share an analogy. I've shared this one several times. It's a dinner table analogy. So envision that we're walking into a restaurant, peak Friday night, Manhattan, full, sounds all good. Tables are occupied, right? What would happen if you walked in, chose a table at random with people, sat down, and started giving them advice?
Yeah.
They would hate me, especially in New York City. They would push me away.
But why?
Because they don't know who I am, what kind of credibility I bring, right? Yeah.
Who's this guy? That's a huge norm violation. in a setting at a restaurant. I can't imagine any of us would go sit down and start giving people advice unsolicited at a restaurant. But that's how the health profession has for too long treated the internet. The internet is a busy restaurant with people at their tables with their friends, and we sit down and think they're going to care about what we have to say uninvited. We have been broadcasting messages. We've been using older approaches for broadcast diffusion of our message packaged in a way that makes sense to us,
Right.
and expecting that we are welcome to sit down and share that advice at any table we want to because we know it's factual.
Right.
When in fact we need to be rethinking about social diffusion of messages, meaning not how do I get the fact-based information out to everyone, but how do I get others to share fact-based information? And that is a very different approach and a very different way of using social media and the internet.
And another thing that I have a little bit of an issue with is basically how some of the dental companies are viewing preventive dentistry. And we know the couple of big ones, but a few years ago, Rowene, this was at Penn, and it was on a healthcare symposium, and I was on a panel, and there was a person from the dental school, a PhD research person, and then next to me was a woman from the Wharton School. And during different things, there was a conversation with, and most of the people were CEOs, COOs, CFOs of dental companies and medical companies, mainly dental. And he was a COO. And when we were talking about preventive dentistry, he literally said, we don't think there's any money to be made in preventive dentistry. And the Wharton lady and myself looked at each other like, what is this guy talking about? What company does he represent? Because maybe you should short it. Because I thought this guy had an incredibly wrong take on preventive dentistry. But the reason I'm focusing on preventive dentistry, excuse me, even though I'm an endodontist, is that in conjunction with the promotion of your preventive dentistry products, that's the opportunity to disseminate information. And maybe because I don't have kids, maybe because I'm not that age, I just don't see an effort. Obviously, the big companies, Colgate, Crest, they have websites you can go on and you can go to it. But there's a lot of people who are not going to go onto their websites who I think would maybe, it's probably not the right term, but let's say susceptible for having some learning about preventive dentistry.
It's just education. I guess that's all.
That's
education.
totally
Education.
Well, and just like it would be a norm violation if we go just sit at someone's table and offer advice. Similarly, they're not just going to come sit at ours and ask for advice, right? And so when we think about, approaches for finding this common ground, I think the key is to remember that it's really not about the information. It's about the social aspect of decision making. And that comes down to our identity. So when we're having a conversation with a patient brings in an article they found. That article, there's an entire social network and identity tied to that article. And when that patient says, this article, they're saying this article means something to me, what they're really saying is someone I trust shared this with me and I value that. So when we correct them, we're not saying to them that article's not factual. We're saying your social identity is wrong, and that is dismissive.
Right.
So when we think about recognizing what's tied to our identities, both we're coming in as identifying as a healthcare provider, a scientist. Our patients are coming in with their social identity tied to this. Then we think about building that connection, supporting our identities in that conversation, sharing those stories so that we're building in opportunity to personalize the conversation, to create connection so that we can sit at the table together in the busy restaurant and become a trusted peer at the table, and that then is the opportunity to introduce the evidence.
Yeah, it's a good way to think about it, and I think you frame it as I care, and I think that's a great. You talked about identity, connection,
Anecdotes, and
the last two are request and then evidence. So on that point, Dr. Dr. Seymour, as we talk about how to get good information across, you mentioned something, Dr. Nasa, which was we have to, basically beat up the mis and disinformation with good information, which means the quantity of output that we're putting out is greater than the poor information that's out there. But to your restaurant analogy, I feel like when people go to the internet, oftentimes they are open and receptive and sort of, without explicitly saying so, looking for help and advice, right? So you can imagine the traditional scroller through Twitter, Instagram, TikTok. Those little clips that we watch are sometimes very informative and a really great way to get information across. What would your advice be to dental professionals who are listening to this, who want to do better at educating their patients on the right information? What is the best way for them to get that information across?
I think similar to what you're saying, I think information that, I'm going to go back, feels personal, allows them to build an emotional connection. It feels relevant. They look at that and say, that matters to me. That aligns with who I am. And sometimes that means we are not always the best messengers. It means we build networks, and we can be influencers within those networks, but we rely on the network dynamics to help propagate these messages. And that's how the algorithms online work. They want people to keep coming back to their platforms and having a great experience, and that relies on these networks and relationship building.
Right.
So I think those of us using these platforms and hoping to share information need to kind of rethink our mindset. It's about relationship building.
Right.
Totally.
Absolutely. And to the same extent, I feel also is that, when you have to validate people's fears, because their fears are legitimate to themselves. I mean, obviously they want health, they want to have safety, they want to make sure that nothing bad is happening as a result of them trusting into some institution that could be wrong. And, in their view, could be driven by financial incentives or various different things, which is the way people think nowadays. As people have lost trust in all institutions, it's always a question, as you said, follow the money, and therefore they make decisions based on some of these concepts. So, I think validating is number one, and that kind of helps bring down the guard so that you can then probably getting in through an emotional component, sharing anecdotes, keeping not at the level of a high science, highbrow science type of a thing, but at a very kind of basic level of, for my case, I'll always say, people in my family have done plenty of procedures in my family in this particular thing that you're afraid of. And that obviously, as you can tell, I've had it myself. I've done it on my, family members, parents and stuff like that. So I feel that's much more connecting as opposed to say, according to the association of so-and-so, X and Y is an invalid fear that you have.
Yeah.
Right.
So it just kind of brings it down to level. Look, to the best of my knowledge, I'm doing what I saying.
Right.
Yes.
Walking the walk.
Yeah. And that is probably much more helpful. And in that sense, it does help somebody like me with bad teeth. It does help because you can do it all yourself.
That's so. Yeah.
But if you have perfect teeth, it's going to be a tougher sell for you. But it also goes back, I think, in some ways. Sorry, Rena, I'm going to hear your thing
it's
because
okay.
I want to know if this is something you guys are going through in terms of learning.
Oh, yeah.
Is that, we had this discussion with some of the residents, actually, I think it was yesterday or a couple of days ago. We were talking about the fact that, look, we cannot treat everyone the same way.
Wow, that was my next point. I don't know how you just read my
That's what
mind.
I'm saying. So, because everybody comes in with their own personal baggage. As you said, it's psychology. So the best clinicians, the master clinician, doesn't walk in with a cookie cutter approach, but is constantly pivoting based on information that you gain based on the patient personality, right?
Yes.
So I know there's different personalities in these patients, and you need to recognize, and in some ways, you need to thin slice people, figure out what they're all about, and then you have to, upload the personality of the doctor that would be best for that particular patient, and that would be the type of kind of, the equivalent of the 1 Minute Manager. I don't know if any of you guys read that book or not.
No.
It's an interesting book. So scientists there's no one way to manage. You manage different people at different times, under different circumstances, and a different part of the thing differently.
Yeah.
And that's the whole customization. It's kind of like precision medicine versus just cookie cutter medicine.
Yes.
Part of precision
the psychological
medicine is emotional intelligence, right?
Yeah.
What were you going to say?
This was precisely where I was going with this. I feel like we've talked so much about the positives about sharing and the negatives about sharing information on the internet, but I think we can all agree that it all is generalized to some extent. And all of those people that are listening, even listening to us now, right? We can only speak so much, but everyone has their own experience. And that's why I think we can all agree there is still and will always be so much benefit to sitting in the chair, talking to your doctor, sharing your story, sharing your background, and then getting the advice that is tailored to you, because that's really what we're trained to do. And that's something that we'll never really be able to recreate on social media, unless it's like telemedicine or something and we have the time and space and HIPAA and all that. But yes, I think that as people are consuming this information, it's always good to know that, and that's why there's always those disclaimers on the ads you see on TV. Please contact your doctor if you have any of these side effects, like, you know, because you never know. And not everything is going to be 100% applicable to everyone. And I think it's very difficult to make a video on that ever. So I think it's a good point, the personalization aspect of it.
That starts by listening, right?
Yes.
I mean, that's the key part. That's what we talk about, doctor-patient relationships, all about active listening to begin with before you talk.
Yeah.
But
Dr. Seymour, before we wrap up, I want to have the audience please comment and let us know what you guys think is the best way to get good information across, and what have you come across has really irked you about bad, disinformation, misinformation in the dental space. But Dr. Seymour, as we wrap up this amazing episode, we want to ask you, what kind of parting advice will you leave our audience today?
That's a good question. There's
so much.
I still don't consider myself the expert. There's so much to still learn in this space. I would say,
maybe to the patients and to the doctors.
Yeah. I would say for the patients, be patient with us. We are learning. We have been trained in a communication environment that is rapidly evolving.
Yeah.
And we don't always default to listening first.
Right.
We have a reputation for that because we're so excited to share the science with you. I would say for providers to remember, when it comes to communication, we are social creatures. We are literally wired to be social for survival. And an engaged patient who brings us a dental myth is better than a patient who is disengaged and isn't asking us for advice. And so just when we enter into those discussions, I learned the hard way to reserve judgment. I had to work through that. I would say, remember that social proof will always outweigh scientific proof. And so to remember to develop that social validity and that social relationship so that we can really be effective communication.
That's incredible.
That's terrific advice. Maybe dental schools should also, as well as medical schools, focus more on dental communications.
I think so. Like media literacy. I think it should be part of the education coming out of school. I do.
Annie, you want to have a last word?
Well, it's interesting. I think one of the big things is building trust. And I'll use an analogy. Those are dental phobic patients. Because of my position at the school, I had the experience to treat many, many serious dental phobics who would come into Boston from around the world. And what I mean by phobics was that I would walk into the treatment room and they'd be sitting perpendicular in the dental chair. And when I would introduce myself, they would start crying. That's going to be a challenging day, doctor. Okay. And one of the things that I would do, I would spend time that whole first visit developing a relationship. And when I would try to do something done very simple by the end of the day, when I start to work, if you feel anything, if anything bothers you, raise your hand and I will stop immediately. And invariably, I would do this because it's a method to the madness. And person would be numb. I'd take the handpiece, I would start to go in the mouth, and I would not even be anywhere near the tooth, and the person would raise their hand. I know many, many dentists, maybe this is a generational thing, that when they try to do that with patients, they say, I'm not even touching your tooth, and we continue. I never did that, not once, because my agreement with the patient was, meaning if you feel anything, raise your hand, and I will stop. And what I would do with those people, they would raise their hand, I would stop, I'd put the handpiece down, and then in a very calm way, I would describe to the patient, did you realize, you probably don't, I wasn't anywhere near touching your tooth. But my agreement with you is that if you have any issues, any pain, any problem, raise your hand and I will stop immediately. I found that helped me get, I think, really good success with the dental phobics. The sad thing is, I think I had much better success with dental phobics than I had with people with preconceived misinformation ideas.
Terrific. So, awesome. All right. So let's come back for the second part of this, where we spend this time talking about misinformation, disinformation, and patient management. But in the second segment, we're going to come back and talk about top 10 dental myths and see how we can manage it based on this framework that we just established.
Yeah, let's do it. Sounds good.
Sounds good.
Thanks for joining us, Dr. Seymour.
Thanks for having me.
We'll see you in the next episode.
Turning pulp into gold with every word. A show like no other you've ever heard. Health and hearts we craft and mold. Tune into pulp where stories unfold.